Good afternoon. I'm Charlotte Jones Carroll, and it's my pleasure to introduce our speaker, Dr. Shannon Hader. I met about several years ago when she became the Dean of the School of International Service at American University, which is my alma mater. And after several encounters at university events, I discovered she has this whole resume, this background, which totally clicks with Rotary cause of global disease eradication. So she has, you've seen her details, I know, but she has worked on disease eradication at the local DC Department of Health, federal, national level through PEPFAR and CDC, and then global level through UNAIDS office. So I think you really couldn't have a better speaker about global disease eradication than Shannon Hader.
First of all, just thank you so much for inviting me to be here. It's such a privilege. I am a huge fan of Rotary. Among other things, I am a pediatrician by training, and I got introduced to Rotary probably when I first joined U.S. Centers for Disease Control and Prevention back in 1999, because Rotary was such a driving force in global eradication of polio, and has continued to be a stalwart force in the momentum to eradicate polio worldwide, even though we're going a little bit slower than we wanted to. So it's a huge privilege to be here. And great that it's a month that we're talking about disease eradication for Rotary. And also this week is the week of December 1st, and December 1st worldwide is World AIDS Day. It is the day that we sort of recognize and commemorate both everyone who's been lost to the disease, but also everyone who's been an actor, a leader, a change maker for creating a better world in this world of HIV. So it feels very fortuitous that I'm able to come here and talk today. And with that, I think what I'm going to talk mostly about first is children and HIV. Hopefully giving you guys a little bit of a snapshot and update of the children and HIV story and where we're at. Full disclosure, in another one of my non-work hats, I'm on the board of the Elizabeth Glaser Pediatric AIDS Foundation. And so I still dabble very close to my heart in the current events for children and HIV. But I think particularly for Rotary and given your history and being an advocate and an actor for children's health issues, you know, the current children and HIV story is really a story of both tremendous progress and tremendous work left to be done. And the theme on both sides of how progress has been made and how it's going to continue to be made is really three things. Number one, leadership, 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 which is why it resonates with Rotary as well. Second, the real miracle of technology and innovation, and how having more tools gives us more potentials to fight these epidemics. Third, actually, I would say it's about the rights of children and people who both care for children but also care about children's rights. And, you know, a recall and a remembering that children have very little that they can do to actually their own rights. It really takes the leadership of adults and communities to make sure that happens. So with that, maybe setting new pictures of the HIV response. Really to start, first, driving research, scientific research into how do we prevent and take care of kids living with HIV. And over the years, that foundation, and Elizabeth died in 1994, so this the year before treatment became available. So this foundation and this movement has continued since then. And even for the Elizabeth Glaser Foundation, their remit very quickly went from looking at children in the United States to looking at and trying to be a voice for children all over the world. I finished my training in pediatrics and in public health really around 2000. And in 2003, there was a huge milestone for any of us that were AIDS docs or HIV advocates or anything else. And that was the start of the PEPFAR program, the U.S. President's Emergency Plans for AIDS Relief. PEPFAR, as many of us affectionately reference it all the time, was founded in 2003. It was announced by George W. Bush at the State of the Union address. And it was at that time, it was the first biggest commitment ever to a single disease that any government had ever made in the history of the world. And it came from a fairly bold and audacious place of saying, you know what? People are dying. People are dying all over the world and especially all over Africa. And this is unacceptable. And so it put out massively audacious goals for prevention, for treatment, and for care, including for the care of orphans and vulnerable children who had been orphaned by HIV/AIDS in a way that no one actually thought was achievable. This was about 8 years after treatment had been available in wealthy countries, and it was almost non-existent in non-wealthy countries. By 1995, we knew that if you had these sort of complicated intravenous treatments for pregnant women living with HIV during late pregnancy and through delivery, you could reduce transmission to babies. By 1999, we actually knew that, in fact, you can give pregnant women one dose of one of the drugs during delivery, and that could allow a lot of the transmission to babies. And yet, none of those resources had been made widely available in the countries that were most highly affected. And so George W. Bush announced this and put huge amounts of his own political capital behind this in 2003, and actually had very much been able to coalesce bipartisan, bicameral support for this brand new, unprecedented initiative. And I think a lot of the energy behind that coalition and that coalescence was because there were a lot of different reasons that were finally visible for different to get behind this back in the day. Certainly, there was a humanitarian reason. People are dying, but that humanitarian reason had been there for a really long time. There was also an awareness that this was becoming a security issue. If you had communities, especially around Africa, where essentially 40%, 50%, 60% of the parental age grown-ups were dying, leaving young children and teenagers and grandparents to try to navigate society, that really left a lot of future youth available for radicalization and disaffectation. There is a whole other sort of contingency who had been looking to the continent to be a driver of economic growth. Africa is a driver of economic growth in the 2000s. And if your working age population is dying, that's not going to happen. But also, there was a real movement by politicians and other actors who cared about kids and kids' survival. And that ranged from lots of movement by faith-based organizations. In many countries around Africa, many of the rural healthcare is provided by faith-based organizations, whether they're Catholic or Methodist or other, denominational. But many of these faith-based organizations who had been directly involved in healthcare for a long time were in areas where they just saw parents and children dying and nothing that they could do about it. And they made their voice very clear to Americans about this. Similarly, some politicians who are very famous for having said some incredibly ugly things about HIV and people living with HIV in the United States, when they got exposed to the suffering of children around the world from HIV, they had a sea change. Representative Jesse Helms from North Carolina had not been a real big proponent of an HIV response in our country until he discovered what was happening with children. And he had been a lifelong advocate for children with disabilities and interventions. And so he was a big champion of this PEPFAR program as well. And so that's really 2003 really chauffeured it to an of being able to do something. Now, for me, this was a milestone time because to Bob 2003, to lead on U.S. Centers for Disease Control and Prevention's first HIV program office to work with the national government to say, how do we not just study things? How do we not just do science? How do we actually do national scalable interventions that save lives? That was for Zimbabwe. That was a time with mass political, economic, and humanitarian crises that were going on. We had all driven by political crises under President Mugabe at the time. So we had 1,000% daily inflation with no dollarization, trying to roll out brand new programs around the country. And it was, the national government and the faith-based healthcare infrastructure that was rolling out these new programs, and we were there to help. But, two things on that. One of those was massively scaling up prevention of mother-to-child transmission programs in antenatal clinics throughout the country, going from 1, 2, 3, 4 to over 900, 1,000 sites to provide wide access. But also going from fewer than 400 people in the country on life-saving HIV medicine, and that were 400 people at a rural Italian mission hospital that was bringing drugs in suitcases to be able to support their clinic, to over 40,000 people through a national program within 3 years that doubled to 80,000 the next year and 1.2 million the next year. But when I got there in 2003, and the Rotary Club of Harare was the first place that asked me to come speak to them. Oh, is it really? Yeah. So I have a glass from the Rotary Club of Harare, actually, because they were, some of the community groups leaning in saying, how do we help with this? What do we need to know? What do we need to do? How do we support the rollout of these services? I have to draw the picture of part of what my job was is I went to funerals on the weekend. Funerals for team members within CDC and their families. And one of the big cemeteries in Harare, huge 5-acre cemetery, people were dying so quickly of HIV that you had to start to schedule your funeral services. So each hour and a half, there was another schedule, and you only had your time to be able to go in and many different sites at the time. And to walk into these graves, I would always have to walk past the children's section where you see all of these graves of babies, including how many are fresh because you can see the freshly covered graves there. And it was palpable and dramatic and tragically common for every single person in every single family to have been personally affected by this disease. And so that's a bit of a stage setting so that I can say a little bit of, and now 20 years later, 22 years later, what's changed? Tremendous, amazing successes because of that leadership, because of that scientific technology and innovation, because of people who have cared to be a voice for children and access. Since 2000, at least 4 million babies who would have otherwise been infected had now been prevented from being infected at all by HIV through the whole constellation of these many interventions. It means that, we've gone from a peak of 2.5 million 2.5 million children under the age of 14 living with HIV back in 2010 to less than about half of that, 1.4 million children living with HIV across the world today. We've reduced the number of new infant infections, pediatric infections each year to about 120,000 new infections a year worldwide, which is down about 40% over the past decade. But let's just say that's still a lot, right? 120,000 new infections each year. 75,000 children last year still died of AIDS, died of HIV-related causes at a time where we have diagnostics, we have prevention, and we have treatment. And so we are at a point where there's still tragic missed opportunities. And the reason I bring up this issue of children's rights and who's going to be the voice of them is because guess what? We're doing a lot better for adults than we are for children. So somehow, even though much of the political will, much of the dedication that led to the PEPFAR program, that led to this worldwide galvanization of a response, came through people who cared about children. As we've become more successful, children have gone by the wayside. So, there's several ways we look at our success in combating this disease, and what interventions work for children. Number one thing that we have found is even more effective than that 25-year-old one dose trying to prevent transmission to babies of a one dose during delivery, is in order to prevent breastfeeding. That one dose doesn't work. We now know for adults that adults who are on life-saving who know they're positive, so they can be in life-saving HIV treatment, and that treatment we know is effective because their virus is suppressed. We call that viral load suppression in their blood. People who are benefiting from the treatment with zero virus detectable in their blood can't transmit HIV to others, either adult to adult or mother to baby. So the number one single most important intervention for preventing transmission these days, and we have actually number 2 and 3 now, is people who are living with HIV know they're positive, they're on effective treatment, they're benefiting from that treatment, and then they are what we call undetectable as untransmittable, and that includes, for the most part, during pregnancy, during delivery, and during breastfeeding. So there's been a huge, great push to get all adults, of course, and especially women and women who are pregnant, diagnosed early on effective treatment, to then also prevent treatment to children. Well, in that sort of how many people living with HIV know it and are on treatment and they are benefiting from that treatment, that's where we see a lot of difference between adults and kids. So at this point in time, all the way down that cascade, knowing that you're positive, being on treatment, having no virus in your blood, 75% of all adults worldwide are now in that final tier of being on treatment, benefiting from it, having no virus in their blood. That is a tremendous success. And fewer than 50% of kids living with HIV in the world today are in that same no virus in their blood benefiting from treatment. That's not okay, right? So we've had the tools, we know how to do it, but we're not paying enough dedicated attention, political will, and investment to apply all of the tools we have to allow children to access those services and to get them to benefit from the services. And so I think that is really one of the areas that we need to look at now about how do we double down? How do we double down on what works? How do we double down on our commitments? And how do we make a difference? That's great in general. The UN and UNAIDS has has recently, a few years ago, formed a new global alliance for ending pediatric HIV coalition. Shows a little bit of political will. I have this big diatribe here because they did a 2-year report on it. I'm not going to read you the report because the report just tells you what I just said. Is like, it's nice to make it glossy, but we've got way more to do and we're not doing enough. But I think importantly for this crowd too, and I can't wait for us to have a discussion on this. The US has been a huge leader in this response for children, in this response for adults, in this response both through PEPFAR and another fund that was established about the same time, which is a global fund for AIDS, TB, and malaria, which is sort of a multilateral fund compared to our bilateral fund for intervening on HIV and TB and malaria. And the U.S., was a founding member of the Global Fund. We make up about a third of the Global Fund monies that are donated each year. And yet, all of that is really under threat right now. So PEPFAR has been a unique U.S. government program bilaterally because, for a number of reasons, including it was established through authorizing legislation in Congress, actually. And then it also has a budget, right? So it has authorizing language and a budget that sort of establish 5-year commitments at a time is what it's been. And the 5-year commitments and the authorizing language also have very strong metrics I am quite convinced that that is the reason that for 20 years, this PEPFAR legislation got reauthorized by bipartisan, bicameral, unanimous consent every 5 years for 20 years. And I believe a lot of that had to do because it was so clear on the mission and the metrics, the accountability, that PEPFAR every year could show what we've done, where the money went to, what worked, and what didn't work. There wasn't an expectation of perfection, but there was this idea that we can know what's working, we can know that what's not working, and then we can shift it to make it work better. This year is the first time that the PEPFAR reauthorization failed. It failed. So we have so far failed to get 5-year, what we call clean reauthorization. We are in a 1-year holding pattern. There was finally a 1-year, very minimal continuation that was folded into another funding bill, so that we have 1 year. Of course, we still can have budget without authorizing language, but the authorizing language really shows a commitment, and it helps us in challenging other donors around the world, other wealthy countries, other private sector donors, to say the US government is stepping up and putting this forward. You need to step up too. So it also has impact on the willingness for all countries to fund the global fund, that multilateral mechanism. And so we are a little bit Never Never Land. I'm happy to talk with anyone who's curious. I'll wait for questions on what we think got in the way of PEPFAR reauthorization. But I think it's something we need to not give up on. We are coming into a new year, a new administration, new Congress, new Senate. There will be new opportunities to revisit this again. But it's also a global fund replenishment year, as we say. So it is the every 3-year fundraising cycle for that multilateral fund. And my biggest fear is if the US doesn't step up in our bilateral way, much less our multilateral way, we don't lead by example. We don't put as much pressure on other countries to step up as well. And I don't want us to miss that opportunity. As much as anything, there are a lot of really great ongoing programs that are ripe to be transitioned to national countries' own budgets and their own infrastructure. Much of that is already happening. But we need to not think that we've gotten it all done for children. So children have to be back on the table, back at the forefront of how do we close the gap? If we've done this well for adults, we need to do this well for children. And then third, we're actually in this very brand new sort of opportunity era of even beyond what I've already described. There are some brand new medications for prevention, biomedical prevention, that we call PrEP, pre-exposure prophylaxis, so that people who don't have HIV but are high risk for contracting it can take medication to prevent getting infected with HIV, similar to how the medication helps prevent kids from getting infected intrauterine. And we now have some new drugs that we call long-acting PrEP that, in fact, 2 doses under the skin per year, once every 6 months, can lead to 0 new infections. So that's better than any vaccine we had ever hoped for in the HIV community, because an HIV vaccine has always been complex for a lot of reasons. We failed for 40 years. We would hope for partially effective vaccines, but now we have a treatment that just takes a small, like a diabetes under the skin shot twice a year that can lead to 0 new infections. So we have a new tool, even in a time of vaccine hesitancy, that isn't staying in your body. It's twice a year, that with this additional tool, can you imagine how we can really, literally eradicate ongoing transmission, including new infections of young people and mothers while they're pregnant, that then further reduces that risk for children being infected as well. So there's a time of opportunity here where if we had we absolutely did had a huge leadership surge in the early 2000s that made us a leader in achieving results that were never imaginable in 2003 in terms of the epidemic. And then we sort of got used to that. Well, there is a new window of opportunity to finish the unfinished business with children and to really finish what has not been achieved yet for eradicating ongoing transmission of HIV, period. But it's going to take political will and leadership to do so. So thank you for letting me start that conversation.
Who's taking the lead in the U.S. government? Is it Millennium Challenge Corporation or USAID? Because if it's not coming from the top, we need effective people in the middle who are doing it.
Yeah, great question. So one of the really unique things about the PEPFAR program, and this was set out in the original authorizing language, is it actually put the leadership for PEPFAR under the Department of State. And it made it a whole of U.S. government structure and authority, sort of sort of analogous to a Joint Chiefs of Staff, where it said any agency that does HIV programming or investments around the world for the U.S. government, don't care who you are or what it's for, the authority for you to spend your money now has to be approved through this, what was the Global AIDS Coordinator, which is an ambassador at large position at the State Department. Over the past administration coming out of COVID, there was a real priority on potentially doing some changes in the State Department that established a full bureau of pandemic preparedness, global disease prevention that PEPFAR got folded under. And so theoretically, the Department of State and that bureau with PEPFAR should be leading on this. I feel like the bureau is a good thing, but it became actually a distraction to getting reauthorization because it got prioritized in terms of the discussions with Congress and Senate before doing reauthorization. So I find that somewhat unfortunate. So right now, I think there's been a little bit of an absence of leadership. Oh, people would be mad if I get quoted on that outside of here. Good intentions, but fail to execute. We also have a lot of long-standing champions in Congress and Senate who are getting fewer and further between. Representative Barbara Lee, who's retiring, she and her leadership with the Congressional Black Caucus were huge forces in the original design and authorization of PEPFAR. Senator Lindsey Graham has been a huge champion of PEPFAR. And in fact, he was part of a major Senate delegation to South Africa the year before last that was supposed to be the on-ramp to reauthorization. So we need to both reactivate the champions that are still in Congress and Senate, but unfortunately, we need to build some new ones because a lot of the ones that were originalists are now gone. And I hope that because we have new opportunities to do what hasn't been doable before and to finish up this issue with children that hasn't been done yet, I hope that can be a way to activate new champions because, no one just wants to take on an old program and see it, keep doing status quo. But we have some new opportunities and new challenges that really need to be pushed. Part of what's made some of these better drugs available for children, because anyone who does drug development for pediatrics also knows it's last on the development side for pharma because the market's just not, and so the Vatican has actually led that's right. It's very large consortium of the Vatican, Father D'Agostino also, and that's brought together UN partners, private sector partners, including pharmaceutical partners, and NGOs like Elizabeth Glaser and other faith-based, multi-faith-based organizations to provide both technical and political momentum for things like when we got a great new, much more effective drug for adults, to accelerate the research and development down to like getting it out the door for formulations that would work for children. Cutting up adult pills doesn't work for babies. It really doesn't. And even some of the traditional sort of liquid formulations, if anyone here has ever had kids with chronic diseases that you've had to give liquid formulations to, many of them taste awful and they require refrigeration. Through the Vatican, for example, this best new drug, they were able to accelerate the development pipeline by about 3 years to the development of what we call sprinkles for infants, so that you can measure sort of sprinkles to put on a teaspoon of food. That makes it then very digestible and easy from infants all the way along the way. So the force of faith-based organizations and coalescing this has always been very key.
Thank you for coming to the Rotary Club. I have a question, and if you can comment a little bit about the HIV criminalization laws.
Yeah.
And what I'm going with this is the fear we all have right now that some states haven't modernized the HIV criminalization laws, and maybe the impact on the criminalization of abortion.
Mm-hmm. Yeah.
There is a link between the two of them.
Yeah. So let me talk specifically about HIV criminalization, and I can talk broader for sexual and reproductive health and rights. You know, in complement to what I described about PEPFAR, the UN agencies have a unique model. There is a secretariat called UNAIDS, which was actually developed to coordinate the work that I think 14 different UN agencies were doing and are doing for HIV. So to sort of be an equivalent to what the PEPFAR program does, but for the UN. So bring together the WHO's, the UNDPs, and many of the folks that you might not know do HIV work, you know, migration, human rights, all that kind of stuff. And every 5 years, there has been a political declaration that's based on an evidence-based strategy that countries around the world sign off on and say, yes, we're going to make these goals for the world. And this last political declaration, 2021 to 2026, that was passed in the middle of COVID, included for the first time quantitative metrics around rights, actually, based on the evidence of what works and what doesn't work to prevent ongoing transition and to prevent deaths. And one of those, and we call them the 10-10-10s, you know, fewer than 10% of the countries will criminalize HIV, for example. So it's now out there in many different political commitments as a thing, but we're very far from actualization, including in this country. So on Sunday, I was at the White House. President and Dr. Biden hosted a World AIDS Day event at the White House on Sunday, outside on the South Lawn, where they had the AIDS memorial quilt laid out on the South Lawn for the first time in the history of the White House and the AIDS quilt. And did a wonderful, wonderful ceremony and speech. And one of the elements in President Biden's talk was a call to complete decriminalization state by state across the United States. Criminalization does huge things. It has a chilling effect, even beyond its enforcement effect. It promotes stigma and discrimination, and it discourages folks from proactively seeking services, fear of retribution, fear of confidentiality, all of these different kinds of things. And it does not add any value. I could give you evidence after evidence after evidence. It does not add any value in the control of HIV. So, you know, there's more. This is really stuff that has to happen state by state by a lot of investment. And I hope that won't go backwards. But what we're seeing with sexual reproductive health, trans, LGBTQ rights, I think we need to be very aware and very cautious. And, you know, the advocacy and the political momentum that is needed to counter legislation state by state takes money and funding, right? So organizations who want to work on that, whether it's Human Rights Campaign or something else, they are going to need to be able to fund that work to make it happen.
It's a tradition of our club that we plant a tree, and it's part of our Trees for the Capital program in your honor. And so here's a certificate and a pin. And so at a later date, you'll get the location, GPS coordinates of the tree. So thank you so much. We really appreciate it.
Thank you all.
We appreciate you coming today.
Great.
So,
thanks.